My name is Mikkel Foed. I'm the chairman of the ESSM Educational Committee, and it's really a pleasure for me tonight to welcome you all to this second workshop webinar. The topic of tonight is stimulating sexual pleasure in a long-term relationship and relationship cohesion. Is it possible? And we have two highly qualified speakers for tonight, so it should be exciting. This is two psychologists and PhD, Dr. Charmaine Borg and Dr. Marieke Dewitte, both also very involved in the ESSM. Charmaine is within the Educational Committee, and Marieke is our General Secretary of the ESSM. So before we start, I just want to draw your attention to the last webinar also. This is a series, and we have one on managing paraphilic disorders as well in a couple of weeks. So you can sign up for that in the same way you sign up for tonight, and please do. Even more importantly, I want to remind you all that these workshop webinars are really a warm-up to the virtual conference that, due to the COVID situation, we're going to have for 2021, 19th to 20th February, instead of our usual Congress. So please look at our website and do sign up for this. Although it's virtual, it's going to be very, very exciting as well. So this is an important event in sexual medicine. So with these words, it's really my pleasure to first give the word to our scientific chairman, Giovanni Corona, to say a few words. And then after that, on to the President, Carlo Bettocchi.
Thank you, Mikkel. I'd like to congratulate to Mikkel and to all the educational committee of the ESSM for the organization of these webinars. The topics are very outstanding. We have an outstanding speaker. We had a great success of the webinars for the statement and now for the workshop. The first one was a great success. I'm sure that even this one and the other one will be a great success. As Mikkel said, we are preparing a great virtual event for February. So I'd like to invite you to join us and to join this webinar. So I'd like now to pass the words to Carlo Bettocchi to give some words regarding educational project and this particular webinar. Carlo.
Thank you very much, Giovanni, and really thank you very much to both of you, Mikkel and Giovanni, because of course, all of these webinars are really set up and organized very well by both of you. So really, thank you so much on behalf of the society. I think that if you can, this is the people that I'm thinking of. So I think that we have to mention just a few words, and I'm happy to give you only a few words about our educational projects, because our society is really based very much on educational. And we have a very important school of sexual medicine that is running for more than 15 years. And unfortunately, this year, due to the COVID situation, we were unable to do it, but we are happy to announce that next year it will be done, and probably it will be in the last week of August. And we will run also the ESSM advanced course on sexual medicine. That is a new form of school for people who have already some experience in this field and want really to complete the knowledge. I think that this is important because we give to all of the people that are interested the opportunity to learn really everything about sexuality. And today it's really a pleasure to have two very important speakers that are going to give us and all of you really the best news about the topic. I think that we have also another important project that is going to run next year, and this is a new one because it's our ESSM Academy on Genital Surgery. This is really a new way to hand out a training for young surgeons, because it's based on 4 different levels. Level 1 would be based on textbook and video library and some webinars that would be very interesting. And then we will move on a dry lab and 3 model level, that is level 2, to go to the wet lab of cadaver training. And finally, there will be a fellowship in all the centers of excellence that we are proud to have in our society. So this is a new program, and I'm quite happy to tell you that you will see the announcement on the web very soon, and so you can read everything about and possibly participate if you are interested in surgery. And finally, videos. We have a very nice video library. It is not only a video library on surgery, but we also have very good videos also on erectile dysfunction, and we are trying to expand as much as possible this field. So this is, I think, the last thing to tell you is about our manual of sexual medicine. That is already, you already know it, but we are now working on renewing a new edition. And so hopefully in end of 2021, basically, or the beginning of 2022, it will be ready. And you also know that we have a syllabus of clinical sexology, mainly for the psychologists. And finally, we have also now, it is already on market, the textbook on surgery. And I think that very soon we will be able to give you the possibility to have it in our website. So this is basically all about. I don't want to take any more time because there is much more interesting information coming now from our speakers. And so thank you very much, and see you soon at the end of this webinar. Thank you.
So hello to everyone from all over the world, I would think. And thank you for the introductions and for the invitation as well. So I would like to say that for me, this is already a win because I had the opportunity to again connect with Marieke, and we didn't have contact for quite some time. And in preparation of this webinar, I felt that there's so much out there already. It felt that there is also contradictory, perhaps, theories. And in contrast to this enormity of pop attention to lack of sexual desire in long-term relationship, there is actually a lack of scientific base for these theories. There's a lot of theories and sometimes contradictory, but evidence for them not very strong. So I also try to dip deep in my research as well to try to find a context for this, to try to understand it better. And now you can present the questions. We decided to first give you these 2 questions to think about. Of course, we are trying to make it as interactive as we can from behind the screen. So please give some thinking to whether you think this is part and parcel of a long-term relationship. So would you think that this low desire in long-term relationship, it is how it is, it's part of the character of the relationship, so we need to accept it and live with it? Or you don't think that's true, or you don't have a strong opinion? And would like to ask these questions at the end of the webinar to see also whether you moved from your position or if it remained the same. Okay, give you time for voting.
Just a few seconds that everybody has a chance to vote, and then I will share the results.
Okay. Okay, so no strong opinion and no, it's not part of the relationship. I think this is a good start, I would say. So hopefully we can increase that a bit to a higher percentage by the end of the webinar. Okay, we can proceed. Okay, the other slide, please. So the agenda for this webinar is going to be that first I'm going to dedicate approximately 20 minutes to describe the problem. So in the process, trying to normalize this phenomenon. And then Marieke will contextualize the problem, but also gives a suggestion how to deal with sex in long-term relations. What I would like to say here is that I will try to keep it interactive by also asking questions, not necessarily to vote, but to think, to reflect. And I'm not planning to say anything that is prescriptive, but more hoping to provide comfort, to open a dialogue, to discuss about sexual pleasure within a couple, but also with our patients. And I think we need to start from the very beginning to understand, why do people have sex? And many in society, researchers, clinicians, are very prudish. So probably this explains as well why in most of the books about human psychology, there's absolutely nothing or very minimal about human sexuality and almost nothing about sexual pleasure. And why is this important? I mean, before 2007, prior to the number of studies by Buss and Meston, if you ask why people have sex, it was always procreation and sexual pleasure. But these two people did a number of studies where they asked hundreds of people from the age of 17 to 52 the same question: list all the reasons why you have sex or you had sex in the past. And these 4 reasons always emerge: physical reasons, so the tension relief, pleasure, physical desirability, strictly speaking, because you find the other person hot. Goal attainment, for resources, social status, for revenge. Emotional reasons, love and commitment. You want to show to that person that she or he means a lot to you. And insecurity as well. You want to boost your self-esteem. Perhaps you feel you have to do it because you're the wife or you're the partner of this person. And mate guarding. You want to do it because maybe others will do it if you don't. So these are the reasons, the factors that generally emerge when you ask people why do they have sex. Although the reasons for engaging in sex are numerous and of course psychologically very complex, experiencing sexual pleasure is one of the most frequently endorsed. However, as you can understand, it's also very diverse and very subject to the individual and the context of the person. Now, I think this talk pertains mostly to couples, that there is some level of emotional connectivity within the couple, because if there is no emotional connectivity, then the couple will not be a couple anymore. So I'm thinking more of a couple where they still have some level of emotional connectivity, or they want to be in this relationship. They might have kids or not, they might have sex once or twice a month, but they don't feel sexual pleasure. There's no erotic space for sexual pleasure. And the rejection and the pain is large. When you are rejected because the other person that you love or desire does not want you, it's a very painful rejection, because our naked body, our self, is kind of being rejected. And there seemed to be an implicit understanding, and to a certain degree an acceptance, that in long-term relationship, sexual arousal kind of is expected to decrease or to weaken. And this can be for a number of factors. It can, of course, be because novelty reduces. It's automatic that the novelty, the body, we know it, it's not electrifying as it was in the beginning, perhaps. There are other tasks that takes priority. And we also learned all the turning offs of the other person. So if now at the very cue that this person wants to have sex, instead of you feeling sexually aroused, you kind of want go cognitive in trying to avoid this from happening. So it becomes another task, and ending in a lot of unhappiness for both persons, because the person that is rejecting is probably feeling shame and ambiguity, that cannot understand why she or he does not feel like having sex. And the person that is being rejected feels the rejection. And until now, I spoke mostly about sex and sexual pleasure almost interchangeably, but as you can understand, these are very different. We cannot really say that sex entails sexual pleasure. It should be part of it, but generally speaking, sex, we refer to it as we reduce it to the act of penetration. But of course, it's way more than that. I like to compare, as an analog, sex or sexual pleasure with the habit of eating. If you reduce eating to simply the act of swallowing, we would not be doing justice, of course, to the experience of eating. But when I think of eating, you think of the flavor, of how it's presented to you, how does it feel, the context that you're eating, where you are, with who you're doing it. And the same for sex. If I had to reduce it simply to penetration, at the negligence of the foreplay that we say has to start at the very end of the last orgasm. So all this needs to be taken into consideration and won't be doing justice. So we also have some evidence that people that engage in sex more often generally feel better, look better, are healthier, and live longer. So this kind of gives us a reason why we should prioritize sexual pleasure. And another thing that we might mention here is that if you enjoy something, you are more likely to do it again. So I hope that by putting relevance on sexual pleasure, we can learn to reclaim it and prioritize it, because it's all about giving sexual pleasure its relevance, putting it as on giving it the importance that it deserves. And Marieke will shortly provide us an outline on how we shall perceive sexual pleasure and the meaning of sex, and ways that we can learn to apply in order to reclaim and prioritize sexual pleasure. When sexual pleasure loses its meaning or prioritization. I find this also quite interesting, because sexual pleasure, say in children, Marieke, can you move the other slide, please? Yeah, perfect, thank you so much. When we think about children, they enjoy it, so they just keep doing it. So for example, my 3-year-old, she puts her hands in her pants, she likes it, keeps her hand there. She might be watching Peppa Pig, but she likes it, so she keeps it there. Apparently, I also did this, and most of you did this as well. However, when we grow, apparently we don't continue to prioritize sexual pleasure. And as adults, I think we have more negative connotations with sexual pleasure. It's almost we learn that we should not prioritize it, we should not claim it, and it's very likely that we experience some shame or negative feelings about sexual pleasure. So then it's very difficult to try to give it its importance, while we learned to almost try to hide it. I also come from a Catholic background, and I remember that when I was younger, my grandmom or my mom would say, "What are you doing with your hands down there?" And I think, so these are like moments that they are still implicitly probably ingrained in my memory. And I would say that if we learn this, it's very hard then to move towards prioritizing sexual pleasure and give it the importance that it deserves. And interestingly, or I'm not sure if it's interesting, but for me it is, my research focuses about how the core sexual stimuli are quite disgusting. Like, for example, if you had to think about the ejaculate, the smell, the saliva, vaginal fluids, if you're not in the heat of the moment, you don't really have a preference to come in contact with these stimuli. So when you think about it, even if, for example, you exchange all kinds of body fluids, if you're having sex with a person, but then the morning after you need to brush your teeth with his toothbrush, you kind of hesitate slightly, or most of the people would. The same reason is when you're in the heat of the moment, you might just continue having sex without using condom, even if you know, if you're not with that judgment impaired, you know that that's kind of quite a risk. But if you're in the heat of the moment, you think, oh, just one time, it's okay, just for now, and you continue. So we know that sexual arousal, sexual stimulation, which enhances sexual arousal, has a weakening effect on the negative emotions like disgust, for example, but not only, also on shame. And we're now also finding, we're testing this in the lab, that also on the experience of pain, that when you are sexually aroused, well stimulated, there is a weakness in the experience of negative emotions, but also the experience of pain. So my research then highlights the importance, though it might come as a contradictory, I think in a way it also highlights the relevance of upregulating sexual arousal. And there's many ways and means how we can upregulate our sexual arousal. Something that I would like to say is that, kind of to normalize it as well, in a normal relationship, generally in the very beginning of a relationship, we really do our utmost to look perfect, to smell perfect, etc. When sexual arousal, it's at the very highest level. And then when we take it for, not necessarily take it for granted, but where we're in the relationship, number of years in the relationship, we tend to weaken our input, our commitment to the relationship. And as Esther Perel would say, which I really like this definition, she says, we give our all when we're outside, and when we go with our partner, we take the leftovers. And in a way, it makes lots of sense. It's kind of when you're in a long-term relationship, generally, you do not invest anymore as you used to invest in the beginning, while in reality, we should do it the other way around, because the work is being done by sexual arousal in the very first months and years of the relationship. But this might weaken, or at least it fluctuate. So we need to do our utmost to upregulate it. So yes, sexless relation. Oh no, Marieke, you go back to the thank you so much. Sexless relationship impacting on the relationship. As you can imagine, the quality of the relationship impacts on the sex, but sexless relationship also have a negative effect on the relationship. Generally, after a number of months not having sex, or not if there's a discordance in the amount of sex that the couple would like to have, it can also develop into a weakness in this complicity, in the warmth of the relationship. So this starts being expressed in different ways. There might be many questions that arise. Am I attracted to my partner? It's like an ambiguous feeling. Do I still want him to be my man, or do I want her to be my woman? Do I love him? Is she attracted to me? Why does she reject me all the time? Is there someone else? But what we need to keep in our minds as well is that desire is not there constantly, it fluctuates. And we maybe something that we need to mention with this, we can move the slide, Marieke, thank you, that desire fluctuates in all relationships. But apart from that, desire in a woman is not spontaneous. And the spontaneous desire that we generally associate more with men also starts weakening when there is a weakening or reduction in the testosterone. So we say that approximately 3% less each year after hitting the age of 35 to 40. So the spontaneous desire that is generally associated with men starts also moving, or can start moving also closer to this responsive type of sexual desire or sexual response that we associate with women. And in women, we say that sexual contact and stimulation precede sexual response and desire. So this is why Dr. Bazon referred to sexual response to women as responsive. And in general, we say that when people are having sex, when they start having sex, they generally enjoy it. So it's more the initiation, especially in women, because it is this responsive type of sexual arousal, it's not there, that the men then feel not desired sufficiently because there is never initiation from the woman. And there are, I like to have this example that if you compare it to going to the gym, I think when you go to the gym, at least if I talk for myself, I never really want to go, but then I'm there, I enjoy it, I have a great time, and I think, oh, I'm really happy that I came, I feel great, and I'm definitely next time going to come again. But then the day after, I want to go to the gym again, think, oh no, I don't have the spontaneous desire to go to the gym. And I think it's just it's a bit of a ridiculous example perhaps, but you can understand that if you are not, maybe you are not in the mood, but then when you start, then when there is this stimulation, then generally there is enjoyment. And it doesn't mean that because one of the persons does not want to engage in sex again, or does not show or express initiation, did not enjoy the first time. It can be that the sexual encounter was actually quite enjoyable, but then the initiation, other priorities takes place, other tasks are bombarding us, and sexual pleasure again is not given priority. So this highlights, I think, the relevance of creating erotic space and time. We need to plan time. We need to really create the right environment for it and make a commitment to sexual pleasure, which is a must in long-term relationship. We need to give it more, we need to make it more planned rather than spontaneous as we might expect or anticipate that that's the greatest sex. And something else that I thought it's relevant to mention as well is that sexual pleasure is not only for the young and healthy. It is also relevant for those perhaps less healthy, those that have been diagnosed with cancer or are going cancer treatment, those that have mobility restriction, maybe problems that are more associated with older age, which is of course not restricted to only old age, but perhaps more common. So the point that I would like to make here, or to put across, is that we cannot see sex and sexual pleasure as a function of age. There is there can be the understanding that the functionality maybe is higher when you are younger because of the issues that I just mentioned, but actually by time satisfaction there is a dip in mid-age, but then it increases again later on. And there are also other sexual problems that increase with increasing, get better with increasing age, like for example premature ejaculation, and as well the distress. The stress decreases and satisfaction increases. And things that we need to include in our normalization or sex education is that maybe we need to change our strategies when we are older. By, for example, we know that we need more sexual stimulation. Men around the age of 40, 50, maybe they need more tactile information, where when they were 20, they would have full sexual arousal by just a striptease or by visual stimulation. Now they actually need tactile stimulation in their penis, and the same with the woman. They need also more clitoral stimulation. So now I will quickly give the floor, can I say the floor, the space to Marieke to continue. And I just want to say that most of the things that I said here, and probably what Marieke will say, are things that we are aware of. We know these things, but maybe we do not really give space to ourselves to make it important, to make it prominent in our life. And we need to prioritize ourselves, our sexual health and our well-being, and sexual pleasure is a core part of this well-being, I would say. Okay, Marieke, you go now. Thank you so much.
Thank you, Charmaine. It was great to hear all the information you gave, and it's a perfect introduction for the part that I'm now going to talk about, because what is clear from Charmaine, her story, is that the meaning of sexuality is really important. And what we often see in sexual medicine is that we focus on bodily function, and we focus on our bodily reactions, restoring the sexual function, and we tend to ignore the more relationship context and also the broader context, like, what's going on in the world, like COVID nowadays. It has an impact on our sexuality, our mind, whether we feel distressed, whether we have mental resources to actually process a sexual stimuli. So it's really this biopsychosocial phenomenon, but medicine is really focusing too much on restoring the sexual function, and it's only one part. So we should focus also on the meaning instead of only the function, and really treat pleasure as one of the primary outcomes of our treatment, because as Charmaine said, function will decrease over time. So we should focus, when we age, also on the meaning of sexuality and changing the meaning of sexuality, being more flexible in it. And when we focus on meaning, it's important that we also focus on what sex means in the context of a relationship. And we know that sex plays a role in all phases, in the beginning to start our relationship, but it remains important throughout the relationship because we know that low sexual desire can be an important source of relational distress, as Charmaine has indicated. It's actually one of the most prevalent complaints in long-term relationships. And what is interesting is that although we often see this decrease in sexual desire, and there's kind of a decrease also in sexual frequency as a result of this, it does not necessarily associate it with a decrease in relationship satisfaction. And this is interesting, like to see how is this link working exactly between sex and relationships. So when do we feel distressed? When are we dissatisfied with the fact that we don't have sex anymore, or if we have less sex? It depends really on how important sex is. It's when we focus a lot on the quantity and the frequency of sex, then we will experience distress when sexual desire goes down compared to when we focus more on the quality and the pleasure. And that's really what is important, that we learn couples to focus not only on how much sex do we have, but on how much pleasure can we gain from sexuality. It's not about having sex every day, every week. It can be having sex once a month, but really enjoying it. And that's what is important. It's also about flexibility, about adapting to life changes. For example, when you have a first child or when you have children in general, it can be that sex is just not a priority anymore because you have so much on your mind, which has Charmaine has indicated. So it's really also kind of accepting this. It's about expectations. What do we expect from sex in our relationship? And when we focus on these expectations and acceptance, then it becomes really important, the role of sexologists to normalize, to explain. And part of sex therapy is really about explaining to couples how sexual desire works in the context of a relationship. How much cohesion do we need? How much of this relationship satisfaction is important? And when we explain, we can refer to kind of our evolutionary basis. And what we know is that our sexual system is really focused on passing our genes to the next generation. So we want to have sex, a lot of sex, because this is helpful to spread our genes. So our sexual functioning has actually evolved to promote more short-term mating. And like Charmaine has indicated, novelty is important. This increases the sexual desire. But when there's a familiar partner, the same body, the same partner, that decreases your sexual desire. So we do have this natural desire for novelty, which is a little bit less in women because they have more parental investment, but still novelty is an important aspect. So there's kind of this dilemma. We have this natural tendency towards more of sexual promiscuity, but at the same time, we strive towards monogamy because monogamous relationships are socially more accepted and they also work better in our society. So how can we understand this? Well, it's also about thinking about the different phases in our relationship. In the beginning, there's a lot of passion. We have this intense longing for a partner, infatuation. We're constantly thinking about the partner, but this costs time and effort. It interferes with family and societal responsibility. So this is not adaptive. So that's why we kind of evolve towards a more companionate love. It's more characterized by attachment, commitment, it's active, it's stability, it's routine. And this companionate love is actually adaptive because it creates a safe environment to raise our children. It's much more comfortable to be in a companionate love. Passion is great, it's fantastic, but it's really exhausting. So it's not adaptive in the long run. So we have this paradox in our relationship. On the one hand, we want this novelty, change, mystery, and predictability because we need this to sort of increase our sexual desire. But at the same time, we also want the closeness. We want the security. We want a routine. We want stability, but that kills our sexual desire. So what do? Well, like everything, it's about compromising and it's about balancing. It's about, on the one hand, striving towards this cohesion, wanting this emotional connection, but at the same time, making enough space for differentiation, for autonomy. So too much autonomy, obviously, is not a good thing. Only thinking about yourself and me time doesn't work in a relationship. Too much connection, it's also not a good thing. When you're fused as a couple and constantly doing everything together, that would also not work in a relationship because it will lower your sexual desire. It's really about balancing. It's about creating this us feeling, this we feeling, this connection, but at the same time striving towards autonomy. It's about me and you. We are different persons, and that is actually what works in a relationship. So how can we create this differentiation in a relationship? Because obviously we're there with the same partner for these many, many years. What could help is temporary interruptions. Sort of spend a weekend with friends, or even a week, go with a friend and go on vacation. And that can sort of increase the sexual desire and the longing again, because when there's no shortage, there's no desire. So you need to sort of create this sort of shortness. Conflict. We often think that conflict is a bad thing, and of course too much conflict is not desirable, but at the same time, when there's conflict, there's sort of an interruption in the relationship. It's about not swallowing things. It's about really sort of saying what you need, saying what you want, showing about the differences, accepting these differences, and that can create conflict, but conflict can be good to sort of increase the passion. We all know the makeup sex. An affair. Obviously, we're not promoting having an affair, but it's important to think about having an affair is often sort of a signal, and it's not necessarily the end of a relationship. It can really help to sort of lift your relationship again once the affair is resolved, obviously. Small things, doing things on your own, having me time is really important. Solitary activities, not doing everything together, but really making sure that you have enough space for yourself. Doing novel activities. It's about own hobbies, new hobbies, but also doing things together. Like maybe you can sort of do a cooking course together, and then you see your partner becoming really passionate about cooking. And then you see this partner through a new gaze. He becomes less familiar. There's kind of more mystery. You sort of say, hey, this is another person, and you fall in love again. So really creating this novelty in your relationship. You can do that by just doing other things, reading different books and explaining it to each other, finding new interests and becoming sort of reinventing yourself in your own relationship. So what is important? It's about flexibility, it's about change. When you always remain on the same level of intimacy, this really kills your passion. So it's about changing intimacy, preferably increasing your intimacy, which will then sort of increase the passion again by creating opportunities to change, by introducing mystery, unpredictability in your relationship. So when we explain how sexual desire works in a relationship, we can just refer to this evolutionary base and about this balance between separateness and togetherness and explain all this. But often when we think about sexual desire in a relationship, it's also about reframing. It's about rethinking the issue of sexual desire in relationships. Let's take the case of Leah and Tim. They have a relationship of 10 years. They have 2 children, and they consult because Leah has a low sexual desire. Tim is a construction worker. He makes long days, works during the weekends because he wants to earn some extra money. He likes to go out with friends, but there's a lot of conflict because he doesn't invest a lot in the household and the children. He has a high sexual desire and he masturbates every day. And for him, it's really about reducing the stress and relaxing. And his biggest frustration is obviously the sexual problem of Leah. Leah is a secretary at school. She invests a lot of time and energy in raising the children. She doesn't have a lot of me time and she does not feel appreciated by Tim. She has a low sexual desire, which gradually diminished, and there's a lot of conflict recently because of her problem, her low desire. She feels a lot of pressure, so she experiences even less sexual desire. So let's think about this case. Who is here the patient? Is it Leah? Is it Tim? Is it both Leah and Tim? Or no one? There is no problem. It's normal in a relationship. So is there a patient, and who is this patient in this relationship?
Thank you for voting. We just wait a few seconds for everybody to have a chance to give a vote.
Great. You see what I'm heading for. Exactly. So it is really, it's really about what we often see as the couple presents with low sexual desire. And obviously you don't, but a lot of us do approach this as an individualistic problem. We pathologize the partner with the low sexual desire as the one causing the problem, and then we take the partner with the high desire as the benchmark. But that's not how it works, because sexual desire is something relative. It's about having more or less desire compared to your partner. It's about a mismatch in desire. It's about the discrepancy in sexual desire. And somehow this is inevitable because, as Charmaine has indicated, sexual desire is something very fluid. It fluctuates over time and context, and it's normal. So it's quite normal that at a certain point in time, you may experience another level of desire as your partner, because partners do not always follow the same course. But this does not necessarily need to be a problem. It does not necessarily need to cause distress, because we know that when your level of sexual desire decreases at a similar rate, there's less distress. There are also couples who simply accept it, that there's ebbs and flows, and that sometimes desire can be high or low, and that it's just part of life. Often, there's not only a difference in the level of desire, but it's a difference in what people desire. Think about Sarah and Brian having a relationship of 8 years, and they have a difference in sexual preferences. Brian is a professional tango dancer. He's very extrovert, social. He has SM fantasies since he was 20, had various sexual partners, and he explored SM with Sarah, but she did not like it, so they stopped. And he feels frustrated, so he stopped taking any sexual initiative because he misses the sexual freedom and the sexual expression. Sarah is an account manager in a law firm. She's more introvert. She only had long-term relationships. She does not really have a high sexual desire. She kind of prefers the vanilla sex. In the beginning, she was open to explore, but she kind of developed this allergy for SM-related sexual acts because there was so much pressure on it. It was always about this SM. So they stopped it, and now she misses the intimacy. So there are different objects of desire. Who needs to adjust in this case? Is it Sarah who needs to accept the SM preference of Brian and then sort of open herself to it? Or is it Brian who needs to accept the sexual preference of Sarah and cannot cross her boundaries? Or maybe this couple just doesn't belong together. They're just too different. There can be other options, but you have to choose between one of these three answers.
Once again, thank you for voting. Just a few more seconds and then I will share the results.
So it's a little bit divided, and I can understand that this is really difficult because obviously if I would give a fourth option, you would all go for the fourth option, because what would be the best thing to do here? It's about maybe compromise. It's about looking whether we can find a compromise. And in the beginning, what they did is kind of integrate these aspects of SM and the vanilla sex without crossing the boundaries. So great compromise, try to alternate some SM-related sex, some vanilla sex, but it didn't work. Really, Sarah, she didn't get turned on by this SM. So what they actually agreed on was an open relationship. 2 times a month, Brian could have sex with somebody, a mistress. It needed to be a different mistress, so he couldn't go to the same person. So there was a strict agreement, and that worked. So this is also part of a compromise. And meanwhile, they worked on the relationship because they did have different personalities, different interests, and worked on their communication so that they can clearly express what they want, what they don't want, and what their boundaries are. So how can we treat low desire as a couple problem? It's about normalizing it, and it's about really not blaming the individual patient, but reframing it as a couple problem and trying to learn to cope with it. And a very good framework, what we often use in therapy, is the good enough sex model, because a lot of problems developed by expectations. We need to develop more realistic expectations. Desire for and quality of sex may vary from day to day. You cannot have great, passionate sex all of the time. That's just not realistic. Sometimes it's okay sex, and that's good enough. It's just okay. It does not always have to be super. And that's really something we need to tell to patients. Really don't wait for the spontaneous, great, passionate sex, because that's just a treat once in a while, but often it's just mediocre. It's just okay. We can give some specific advices. What is most important, communicate. Talk about what you want and what you don't want. Try something new. Sex is more than penetration. It's not only about the frequency. Again, it's about the pleasure. What do you really want? Balance, compromise, make a wish list. What do you want? What do you want? Okay, can we sort of try to find a compromise and maybe alternate between our wishes? Censored focus exercises, touching each other. It's about giving and taking. And these censored focus exercises are really good homework assignments because it learns couples to schedule these occasions for intimacy. Because Charmaine has indicated, we need to make the effort. We need to create a context, erotic space to make this sexual desire work. It's not waiting until sexual desire spontaneously pop up, because it doesn't work like that. We need to have a sexual stimulus, so we need to actively search for sexual stimulation and create a context in which we can open ourselves for this sexual stimulation. Now, we have addressed now sex as kind of this relationship thing, and how sexual desire works in a relationship, and how we can deal with it, and about internal stressors in the relationship that can sort of reduce sexual desire. But we can also see sex as a broader and more societal phenomenon. So what is the impact of the external stressors on sexual pleasure and relationship cohesion? What about COVID? It's a big external stressor that we're all facing now. So how can we deal with this? I think what is most important is that we need to stop talking about averages and average numbers. There is no average couple, and we don't know what the impact of COVID on average is on couples, because people react very differently to sex. Some may completely lose their interest in sex, some want more sex, or they want less sex, but they have more adventurous sex. Again, it's about this trade-off between quality and quantity. So we have to be careful not to create new norms and performance demand, because couples are very insecure. They're looking for answers like, am I normal? Are we doing okay in this COVID situation? And if they hear about all these average numbers and what is the impact of COVID on the relationship, well, they start to act like it. So we have to be careful, not creating these new demands and new norms. What is the impact of these social mitigation measures, the lockdown, the stress? Well, it may create new problems. It may increase in existing problems, and some couples are really suffering because they need to deal with a crisis on top of a crisis, or it can uncover problems that people didn't realize were there. There are quite some challenges, especially during a lockdown. There's less time, less privacy because the children are constantly around, so there's less opportunity. Balancing roles. It's about working at home, running a household. What does it do with yourself? You have to sort of redefine your self-identity. You used to be this career woman working outside, and now you're constantly at home and you're a constant mom. So it can do something with your self-esteem. Some people gained weight or invest less time and energy in self-care, less makeup, so they feel less sexually attractive. Or maybe their partner regards them as sexually less attractive. You get less compliments because you don't go out, and these compliments are really important. They're harmless. It's about, hey, you look nice, your hair is great, you have a nice dress, and these compliments create some sexual tension. You feel sort of, refueled. It does something with your self-esteem. There's less mystery because you're always at home, and you used to see your partner wearing a suit all day, and he goes to this big law firm and he does all these mysterious things, and it makes him very attractive. And now he's sitting at home in his joggings and watching a screen all the time. So where's the mystery? And being at home all the time also creates this togetherness feeling. There's a lot of us time. And so you need to sort of actively work on this me time. There might be more conflict, more stress, feelings of loneliness, or you feel less motivated to open yourself for sexual desire. You're just not in the mood. Even when there is a context, you just don't feel like having sex. But It's not all about challenges, it's also about opportunities. It can break routines, changing course, trying something else. It's about having a better balance, work-life, prioritize your relationship. It's about investing more time in your partner, in your relationship, in your family. Some invest more time in self-care. They sort of work out more, cook healthier, so they feel better about themselves. Time to discover new interests, read books, do an online course. Again, sort of bringing something new into your relationship, which can increase the sexual desire again. Making the effort, dressing up for each other, doing a dinner date, having sex during working hours when the children are at school, sexting to your partner, even when he's sitting next to you, can be very exciting. Creating something new, something adventurous. And I think what is the most important thing is being mild, tolerant, and kind to yourself and your partner. Don't look away from the problems, but do not make hasty decisions, because these are really exceptional circumstances. So you cannot evaluate your relationship like, how are we doing right now in these circumstances? This is exceptional. So what we can say is just try to make the best of it, as we do in general in life, not only during this COVID situation, but never waste a good crisis.
So thank you, Marieke, so much. I think now we have a number of hints that we can utilize, hopefully for our own relationships as well, because most of us probably are in long-term relationships, but also to be able and more comfortable to open such dialogue with our clients. And when we're discussing different issues with couples that are in long-term relationships. So now I would like to pose the question again and see whether there was a move, though already the start was quite good, I would say, but let us see. Do you think, okay, the voting is already there. That was
start vote again, yeah, for the question.
Okay.
So did you change your mind after hearing this talk?
So thank you for voting. As usual, we just wait a few seconds. I see a lot of you are voting, and I will share the results in a few seconds. Thank you.
Well, it did change.
Perfect, almost, yeah, 68%. I think that's very good. I'm happy. Okay, so after this very good session with Marieke, I think, after I gave you a good description, I would think Marieke really gave actual hints and cues how we can prioritize sexual pleasure. So my answer to the same question that you were asked, I would say yes. But yes, with some dependence. If we can change the meaning of sex, if we can really prioritize sexual pleasure and commit to it, instead of perceiving it as just optimizing the function. It's way more than the function. I would just think again about the food example. We really need to melt with the flavor, so to say. If we do not, and yes, if we do not forget that sexual desire is an important determinant of the relation connectedness. But at the same time, as Marieke also explained in detail, remember the too strong sexual cohesion, if there is not that individuality that we can see, if there is no space, sexual arousal, it's killed, the erotic space, it's not there anymore. And yes, if we can keep a good balance of passion and cohesion and separatedness and yet togetherness, so it's really a balancing act here. And that's our home take message, I would say. So good luck with the balancing.
Thank you very much to the both of you. These were wonderful presentations, as one of the attendees noticed here at the very end. I want to just answer the last question that's come in first. These webinars are recorded and they'll all be online in about a month on the ESSM website. So we have only a few minutes and we'll try to take some of the questions that came in during the talks. The first one was, is this talk about cisgender and heterosexual couples, or do these general principles go for other couples as well?
Yeah, I think there are no reasons to expect that there would be differences between heterosexual couples and homosexual couples. Or, I mean, it's just what we often see is when we look at research, a lot of research is in heterosexual couples, and this is mainly because of a convenience sample, because community samples are easier to recruit as heterosexual couples. But it really is about relationships. It's not only, I mean, you can also have two women or two men having differences in sexual desire or having troubles with sexual desire. And also what we see is in lesbian relationships and homosexual relationships that sexual desire goes down and declines over the course of the relationship. So this is clearly not specific to heterosexual relationships.
And really, just as a general comment, I think, because this is a question we get often, I think from the research that exists, it's mainly in heterosexual couples, just because it's easiest to do research.
Yeah.
And I think a lot of principles do apply. That also goes for other topics within sexual medicine. So it's not a question of discrimination; it's a question of convenience samples, as you said.
I think what we often do is when you open to recruit participants and then you have sort of a few homosexual couples, yeah, it's sometimes difficult because you cannot make comparisons because it's an imbalance in the couples. So that's why we often sort of go for heterosexual couples to have sort of a homogeneous sample. It's really about convenience and not because we have predefined definitions or assumptions.
I agree. Our next question is, do you know anything about sex and desire in arranged marriages? Do they work more for it, or is it the other way around? Is there anything on this?
I would think that the desire is kind of depends on the duration of the relationship anyways. But I would understand from the theory, say, of Esther Perel, that there is more mystery, there's more getting to know that person. So probably the erotic space starts quite large because there is more unknown, so to say.
Yeah. And it's also because they are trained in working for the relationship.
Exactly.
So for them, they will not, as we start with passion. So we sort of expect, well, this passion should be automatic there. And if you're in an arranged marriage, you just learn that you need to work for it. So you will make the effort to create sexual desire as well. So it can be beneficial to sort of have this principle of not waiting for spontaneous sex or sexual desire or relationships to work out, because you need to put effort in it.
Interesting points. Then another question that came in various forms as you were going over this during the talk is all desire in fact reactive or responsive? And does that mean that women, and I guess some men, do not have spontaneous desire at all?
Well, that's what the recent theories about incentive motivation models, what we adhere to, is that indeed every desire is responsive because there always needs to be sexual stimulus. There is something like a spontaneous desire that pops up. We do know that testosterone sort of increases the sexual arousability of your system, which means that when there is a sexual stimulus, your sexual system more easily gets activated. So that's why there could be some kind of a difference between men and women. And for women have this lower testosterone, so it takes some time to sort of react to sexual stimuli. But in all cases, there needs to be a sexual stimulus. Of course, we are not always aware of the sexual stimulus. Sometimes it feels as a spontaneous desire that pops up, but it can be very an unconscious thought or a fantasy or something that triggers your sexual system. But that's an important thing, is that we sort of want to sort of strive towards this idea of spontaneous desire, because it feels like this drive model, like this libido model of Freud, which we sort of left throughout the years because it's not something that suddenly pops up.
And then I guess this will be the final question. This is a double one, I guess. Can diversity in sexual practices improve sexual pleasure in long-term relationships? And how do we make suggestions for experiencing new sexual experiences?
Charmaine, do you want to take, or?
I think not necessarily, actually, that if you have the most adventurous sex, you have better sex. that doesn't equate to the same thing. So it's more about this balance, I would think. And it's also the cohesion of the relationship, whether there is discordance in what they want, if they are coming to an agreement in what they want, or if one wants more or wants different. So I think there needs to be a dialogue to try to have more cohesion and understanding one another, what they want as a couple. And but no, I don't think that by having more adventurous sex, it's necessarily better. However, if you introduce novelty, which both Marieke and myself mentioned quite often, I think that is relevant. So you can have different relationship within your relationship in a way, if you are able to create novelty in the relationship. And this can be also not necessarily reduced to just the sexual act, but can include different contexts to stimulate the relationship, to create that erotic space.
I think what could be, as a sexologist, you can give some advice. You can be sort of in the sense of trying out new things, and it's sort of guiding people in it, like sort of letting them explore, go to a sex shop, looking online, maybe watch porn together. It doesn't mean that you need to sort of watch porn all the time, but just see what it happens, because it can be that you just click it on, you watch it, you say, hey, this is strange, but at least you sort of make a conversation, you stimulate the communication to talk like, hey, what attracts you in this? What do you like? What do you want? And this is really what we sometimes need, is sort of to put people on the shelf there and just make them to go away from this routine and try out something new. And that is something we can suggest, sort of to try out these new things and give some specific advices in that, just to stimulate the communication about differences.
Yeah, I think it's all about opening dialogue about prioritizing sexual pleasure. So there are all kinds and ways and means how you can prioritize sexual pleasure, and maybe actually what we need to do, rather than increasing the turning on points, killing or reducing the turning off points, because most of the time we are such in a pattern of sexless relationships or not satisfying relationships that even the anticipation of having sex is already putting you off. So turning off the turning offs would already be helpful, I would say.
Okay. Well, this is all the time we have. There are many more questions, so we could have gone on for another hour, I think. And I think that's a testament to how interesting this webinar has been and how useful it's been to all of the listeners. As I said before, this is recorded, so in about a month you can go back and rewatch it on the website. And please be sure to keep updated on the upcoming webinars. I want to thank our speakers, Marieke and Charmaine. Wonderful presentation. Thank you so much. And thank you for all the attendees. There's been more than 200 people attending tonight, so this is really wonderful. Thank you, everybody, and have a great evening.
Good evening.
Good evening. Thank you so much.